Today we will start by one of the oncological emergencies, a spinal cord compression. Our topic will be how to think in a systematic way when you deal with a case of cancer patient with suspicious of a spinal cord compression. Spinal cord compression, when you start by, you are in the emergency or in your clinic, and you find a patient presented by neurological symptoms, and you are suspecting that neurological symptoms are related to spinal cord compression, either motor or sensory or autonomic affection, or maybe sometimes only radicular pain only. So you'll start by investigating your patient immediately, because here the timing is crucial. Timing is crucial. Why? Because you have to save the function of the nerve. If you lose the if it's a long duration, you will lose the function. So you will start by doing investigations immediately. We are preferring to do MRI rather than CT to see the extension of the spinal cord compression. And we start by doing basic lab investigations. May help me in the treatment, especially when I put differential diagnosis, it will help me. We put differential diagnosis usually by three main parts. If the lesion intraspinal and intraaxial, we have a lot of differential diagnosis like astrocytomas and ependymomas, or intraspinal extraaxial, we have meningiomas and schwannomas. If it's extraspinal with intraspinal extension, we have most of the malignancies, maybe lymphoma, maybe neuroblastoma, maybe Ewing sarcoma, or non-rhabdosoft tissue sarcomas or rhabdomyosarcomas. So we put our differential diagnosis. As we said, the timing here to intervention is crucial. So what should I do as a management? I have to answer 4 questions. As we said, we have to think in a systematic way. First question, what is the age of the patient? Why? Because according to the age, you may put a lot of differential diagnosis of the malignancies, and according to these malignancies, you may prefer which type of treatment modality you want to use. Second one, the duration of the neurological insult. If you lost the function of the nerve, it's a long duration, and you lost the function of the nerve, so this is not spinal cord compression, this is not our topic. Our topic, we want to fix the nerve function before destruction of the nerve function. So as we said, age of the patient. Second, duration of the neurological insult. Third question, the onset of deterioration. If it's rapidly deteriorating, we have to have a rapid intervention. And we started our treatment. We have our neurosurgeon consultant or on call to be with us from the start. Start our treatment in front of him, under his supervision. So we asked for MRI, we asked for a biopsy as early as we can. We consulted the neurosurgeon. We put answers for 4 questions: age of the patient, duration of the neurological insult, course of the neurological insult. The 4th question, what is the most possible diagnosis? Sometimes you cannot find the accurate diagnosis, and you will deal with the most accurate diagnosis, the most possible diagnosis. So after the answers of 4 questions, we have the neurosurgeon, and we answer the 4 questions. Now we took a biopsy. We have to start steroid immediately now till find the accurate modality. We have 3 modalities according to what we said. الموست common use الchemotherapy modality, especially if it's a chemotherapy sensitive malignancy, or surgery if it's not sensitive للchemotherapy, or radiotherapy. So this is the main three modality we use according the answer of the 4 questions. So this is how to think in a systematic way in a patient presented by a spinal cord compression.